Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm so excited to be here with you today. Dr. Afif EL-Khuffash is here with us. Welcome back, Afif. It's great to have you here at Gold.
Thank you so much for having me, Fiona. It's always good to be back.
Now, I know you've been very busy this last little while, but we are so fortunate to have you as part of our keynote presentation. And of course, this is big news because for those of you listening in right now, you will be able to come and listen to Afif speak on this topic, the journey of the preterm heart from birth to lifelong cardiovascular health. This is an important topic, Afif, and I know, well, looking at your presentation, I know that everyone is in for a wonderful opportunity to take their education to a whole new level. But first of all, tell me a little bit about this topic. Why is it important to you? What struck you as, this one being the one that you wanted to share on?
Because thank you, first of all, for having me on the Gold Learning website and inviting me to be the keynote speaker. I'm actually honored. So thank you so much.
You're very
Delighted to be
welcome.
here. It's actually, yeah, the topic is important because not many people, especially those working in healthcare, actually know about the topic that I'm going to present. Um, Premature birth is rising globally year on year.
Sure.
And we are now at the stage where we are seeing the first generation of people born extremely preterm reaching adulthood, right? And
Right.
what we're beginning to realize now is that there is this ongoing legacy of being born preterm, especially when it comes to the cardiovascular system. So, this sort of new generation of survivors, first of all, it offers researchers like myself and other colleagues that have done a lot of work in this area. It means that we now are beginning to learn what it means to live with a history of preterm birth, especially when it
Mm,
comes to the heart. And there's been a lot of excellent researchers like Dr. Adam Lewandowski, Dr. Kara Goss, that are sort of beginning to characterize the cardiovascular system of adults that were born preterm. And I mean, even when you sort of go through your day to day as an adult, when you have an interaction with, adult healthcare providers, they never ask whether you were born preterm. They never ask your obstetric history because you may be a 30 or 40-year-old coming maybe for, a hip problem or a knee problem and you're undergoing anesthesia. But what we're learning now is that adults that are born preterm do have specific challenges that healthcare providers need to know about. And that's not the only reason why we need to know about this, is that individuals that are born preterm need to know that they're at a slightly higher risk of having adverse cardiovascular outcomes, for example, so that they can optimize their lifestyle, so that they can, work on their modifiable risk factors to try and improve their cardiovascular well-being. Because, being born preterm is a non-modifiable thing. We all have
right.
non-modifiable risk factors, right? So, I
Sure.
mean, both sides of my family are riddled with heart disease, diabetes, strokes, and all of that. So I'm stuck with those, I guess, genetics, and that's why you have to work on your lifestyle. And being preterm is another unmodifiable one that you need to work on. But we're
Hmm.
learning now that adults born preterm, have cardiovascular conditions like heart failure, high blood pressure, and there's other studies that reveal they may also have, lower right heart function and higher pressure in their lungs as well. So these are things that we need to, first of all, characterize and learn the
Hmm.
extent of the issue. And then, second of all, we need to figure out how to actually help individuals that may experience these problems, help mitigate them or get over them. So that's why it's something that's really important. So I really, my main aim is to raise awareness that this issue exists and that we need to be cognizant of it. And we always, I guess, think of preterm in babies as those that are born at the extremes of viability, 23, 24 weeks. But we are now again learning that even late preterm babies may have long lasting issues when it comes to their cardiovascular health. So
Mm,
it spans, you know, a huge number of individuals. 10% of people are born preterm worldwide. So, you can imagine how common
yeah.
this issue is going to be going forward.
Yeah, absolutely. And I think that this is what excites me so much about your presentations. A couple of reasons. One, like you said, we have to continue advocating, getting the awareness out there. Your presentation, I'm just going to mention it again for people listening in, just pause here and say that this is a free and open access presentation. You will have access to come and listen to the live event with Dr. Afif, and of course, the recording if you need to come back and listen to it again. So all you need to do is go to the website right now to goldneonatal.com and register for this event. Okay. So now that I got that out of the way, because I know that people will be listening, or how could I get to this? It's in a conference. It is in our conference, but this particular event is free and open access. So you'll all be able to join us. All right, jumping back into this topic, tell me a little bit about where we're at with the research right now. Sort of what sort of innovations or new research have you seen coming? I always love to know this because I want to know, are we stuck? Are we moving forward? Is there global, interest in all of this? What's happening? And tell people where you are in the world too, Afif, because I think this is of interest to people too.
Yeah, so I mean, I practice in Ireland, in Dublin, Ireland, in the Rotunda Hospital, one of the oldest maternity hospitals in the world. And you asked the question as whether this is sort of known worldwide. And unfortunately, there's only two or three research groups that are conducting research into
Wow.
this topic. So yeah, so it's not actually a well-known topic, and that's why it's really important to discuss this research and make people more aware of it. But we are moving forward. We're at the stage where we're learning more and more about the unique characteristics of the cardiovascular system of adults that are born preterm. We're learning that they do have some challenges, but again, we're learning now that with increased awareness, with better characterization, that we can now work on trying to improve the outcomes in those individuals. So we're still at the stage of describing it, figuring it out, and looking at associations between worse outcomes and maybe risk factors that individuals may have experienced at birth. Because you got to remember that when you're looking at the cardiovascular system of an individual when they are 30, you're going back 30 years ago to try and get the data of the individual that was born, even trying to find out things as to whether this individual was breastfed or formula fed and were there
Sure.
any other complications. It can be very, very difficult. So it's a stepping stone for research going forward. We're now have the luxury of having much better databases that we can link early risk factors to outcomes
Right.
down the line. So we're at the stage of characterizing it, describing it, getting better at describing it, and the next phase of the research will be examining how can we implement measures to try and fix the problem, right? Or even maybe reduce the effect of the problem. Because another important thing to mention, I guess, is a lot of these individuals, although they may have those cardiovascular issues, they may coast along life when they are not exerting themselves. And
Hmm.
the problems only may become apparent when they're under stress. Either they have decided to run a marathon or they become unwell. That's when the clinical issues, may
Wow.
manifest more clearly. Um, we're again, there are a lot of individuals that may not lead an active lifestyle and they may
Sure.
coast along, and their heart is coping as long as you're not really exerting yourself. But once you undergo exercise, for example, that's when you see the ill effects. But again, ironically, we're now learning that regular exercise can help offset the
Mhm.
effects of prematurity on the cardiovascular system. Even though exercise may unmask it, regular exercise, building yourself up slowly in terms of exercise, can actually help fix the problem. We're learning more and more the magical effects of breastfeeding on cardiovascular health down the line. I'm going to be presenting some work demonstrating that you know preterm individuals that were predominantly exposed to breast milk have a much better cardiovascular profile in adulthood when you compare it to those that were exposed to predominantly formula. So even raising this awareness will help set the scene for future generations. If we can work on improving breastfeeding rates. The last time I was here giving a talk, we were comparing mother's own milk with donor milk. So again, we're learning that giving babies more mother's own milk may may be better for the babies down the line. We certainly know that, breast milk for preterm babies is better than formula. So it's just helping us focus our efforts early on to try and improve outcomes down the line. And for individuals that are adults already, we're now learning how to offset it with exercise, for example, and adopting earlier, better lifestyle decisions much earlier on. And also, yourself, sometimes adult healthcare providers may only jump in with fixing, let's say, high blood pressure once the high blood pressure is well established. So the
Right.
suggestion for adults that are born preterm is that you don't wait until the blood pressure is well into the abnormal range. You start treating and you start intervening when it just touches abnormal, and when it reaches the upper end of normal, that's when you go in and try and help reverse blood pressure, or try and treat blood pressure with medication, lifestyle, and things like that. So these are the things that are being suggested to try and help mitigate those issues.
That really is incredible. And just looking at, this opportunity to sort of bridge the gap in care, it seems like we have missed this sort of opportunity. Like you said, we're at 20 years now, we're seeing these preterm infants into adulthood. It is critical, I feel, that this message gets out there. This presentation hits everybody. There isn't a person who works in healthcare that really shouldn't be listening to this, because I think that the importance, it crosses all barriers. So it'll be extraordinary to
Yeah.
see how folks can take this information and really get it into practice, policy, whatever it takes, the conversations that we need to have. Afif, thank you so much. Appreciate again your time today, but not only your detailed work and your research in this area, the journey of the preterm heart from birth to lifelong cardiovascular health. I'm going to look forward to seeing you very soon on our Gold Neonatal Conference. Thank you again, Afif.
Thank you, and I look forward to giving the talk.
Yeah, absolutely. Well, thank you again to all of you who listen in today. I can't wait to see you again of course, on our website live. You'll have an opportunity to sit down with your colleagues and Afif, who will be with us doing a live Q&A on the day as well. Thank you so much again for joining me here today. Bye-bye for now, everyone.